Good day, everyone. Thank you for tuning in again. We're going to have episode number 9, which is going to be pneumonia. So, everybody at one time in their life is either exposed to pneumonia or, gets sick from pneumonia. And it's just one of those things, that you need to be aware of. Some people with a simple cough think they have pneumonia, which they don't. Other people with severe coughing and mucus production, fever, and chills don't think they have pneumonia, and they do. So it's important that if it's out of the ordinary and you feel a lot sicker than you normally do with a quote-unquote cold, then you should get it looked at, have your physician notified, or go to the emergency room if you get very sick. Now, there's 2 different kinds of pneumonia. There's a viral pneumonia and a bacterial pneumonia. And basically what the infection does is it inflames the air sacs in the lungs and causes them to fill with fluid. That's how you get that productive, moist, wet cough, usually yellow to start with, then can turn greenish, and then can turn bloody. So that's the pathology of it. Now, what is viral pneumonia? Viral pneumonia is actually more common than bacterial pneumonia. It's what we call mycoplasma pneumonia. And the common causes of it are flu, the influenza virus, and common cold, rhinovirus. Also RSV in children, which we now know there's a new vaccine for that. COVID in older adults. And it's generally spread by coughing and aerosol spray. So the difference between a bronchitis and pneumonia, because a lot of people get bronchitis, which is an infection in the trachea and the upper airway, but it's not really a pneumonia. You get a chest x-ray, it's negative. Maybe you got a little fever, a little yellowish, greenish productive cough. That's not necessarily pneumonia. That's more bronchitis, and that can be easily treated with bronchodilators, hydration, rest, antipyretics, and antibiotics. A lot of the bronchitises are viral. That's why the Zithromax is so effective in treating that type of bronchitis. Now, what are the symptoms of pneumonia? Okay, what makes pneumonia different than bronchitis or a simple cold when you present with it? Well, usually you have a fever, 102, 103, pretty significant fever. You can get chills and sweats. You have a productive cough, like I said earlier, either yellowish, greenish, or bloody. You get short of breath with any exertion or even talking. You get headaches, arthralgias, which are achy pains in your joints and muscles, generalized weakness, and pleurisy, which is when you take a deep breath, it hurts and it's painful and it's sharp in nature. And sometimes it prevents you from coughing and coughing up the sputum in your chest. Now, those are viral pneumonias. Now, bacterial pneumonias are a whole different animal. It's usually caused by strep. That's the most common cause. And there's other bacteria, but they're less common. And that, presents as a more significant disease because you can get sepsis from it. And sepsis means it spreads throughout the body and affects all your organs, and people can die from bacterial pneumonias, much more common than from viral pneumonias. So, how do you diagnose pneumonia? Okay, you got all those symptoms. You wake up, you're feeling lousy, you're achy, painy, you got a fever, you got chills, you got a productive cough, you're short of breath. It's worse than the common cold symptoms you've had all your life on and off, and it's worse than viral pneumonia. So you go to the hospital, you call your doctor, you go see him, whichever one, works out best for you. And you have all those above symptoms I just mentioned. So he does a blood count on you, a CBC. And if it's bacterial, strep pneumonia, then the white count's going to be elevated. Normal white count can go up to about 10 to 12,000. With pneumonia, it could be 18 or 20,000. And you get a left shift, which means it's acute. Now, with viral pneumonia, you can actually have a normal white count or even a suppressed white count. And instead of having segs, which we call the type of white count that you get with bacteria, you can have lymphocytes. So you can tell by just looking at the CBC, whether you're dealing pretty much with a viral or a bacterial pneumonia. The other thing is you do a COVID antigen test, the 45-minute test you can do in ER or your doctor's office. And, that'll tell you, if you got positive COVID and you got pneumonia, then that's, a serious complication. So that needs to be treated right away. Plus, not to mention the contagion of it. So, now you've done your CBC and your COVID test. Then you get a chest x-ray. And chest x-rays are pretty definitive for pneumonia. And in a bronchitis, it could be totally normal. Even in viral, sometimes it could be totally normal. But in bacterial pneumonia, you get consolidation of the infiltrate. So your lungs, either your right upper lobe, your right middle lobe, your right lower lobe, your left upper lobe, or your left lower lobe, you'll have a consolidation. And that means you'll have like a whiteout on your chest x-ray. The doctor can definitely tell, okay, he's got a right upper lobe pneumonia because the right upper lobe has a whiteout associated with it. You can also have fluid in the lung. So chest x-ray is pretty definitive. Then you grab a sputum. You have the patient cough into a cup and you send it for a gram stain, which you get back, within a half an hour, 45 minutes. That'll show you if it's bacterial, it'll show you this classic strep bacteria that you'll see on the gram stain. And you also send it for a culture and sensitivity. That usually takes anywhere from 24 to 48 hours because you need to know specifically what you're treating, what type of bacteria you're treating, and the specific antibiotic that'll be sensitive to killing that bacteria. You can also get blood cultures and do a culture and sensitivity on that if you have a high fever. So now you've got the diagnosis. So how do you treat it? Well, some simple supportive care is rest. You don't want to be overexerting your body. Aerosol mist moisten the sputum so when you cough, you can get it out. You can either have a humidifier, vaporizer, or a specific bronchodilator, which will dilate the lungs and allow it to expectorate. You need IV hydration. You need antipyretics, which will lower your fever, Tylenol generally, and any other over-the-counters, non-steroidals, ibuprofen, Aleve, Advil to relieve the muscle aches and this and that type. Now, you may need, or you certainly will need, an antibiotic if you get the diagnosis of a bacterial pneumonia, and you'll be able to tell what antibiotic to use by the culture and sensitivity you obtain from the sputum, 24, 48 hours later. Now, in flu, you treat it with Tamiflu, and it usually has to be within 3 days of the onset of symptoms. If you've had it for a week and you finally go to the doctor and he says, yeah, your flu, test came back positive, it's not going to do any good to take the Tamiflu. So you got to, get it within 2 days, preferably 3 at the most. And Paxlovid, if it's COVID. So you don't necessarily want to be on antibiotics for a flu, and you don't want to be on antibiotics for the COVID because it's not a bacterial infection and it won't really help you unless you've got a bacterial infection associated with the flu and with the COVID. Then you would need the antibiotic as well as the either Tamiflu or Paxlovid. Now, complications. What type of medical conditions you have that will complicate the flu and turn it from a condition that you can moderately easily be treated with antibiotics and supportive care to a potential life-threatening condition. So the main thing is COPD. If you got emphysema, chronic obstructive lung disease, and been a smoker for 40 years, you're already on a limited supply of lung activity because of the emphysema destroying a lot of the lung tissue, whereas most people only use, if you're healthy, a non-smoker, even if you're young, you're only really using a third to a half of your lungs during a normal day. So you've got some, extra, compliance available to you if you need it, if you get pneumonia and stuff. But if you got COPD and you're just marginal, you're just getting by with the residual lung damage that you have, and you get pneumonia, that could be, life-threatening. The other one is if you're immunosuppressed, if you're on chemo, and your ability to fight off infections with your white cells and your SEGs, which I mentioned earlier, are depressed, your T cells are depressed, then you get pneumonia with the immunocompromise. You can get very sick from that, and that could be fatal as well. And the last thing is alcoholism, because a lot of people that are alcoholics, they go to bed at night, they sleep, they're laying flat on their back. Maybe they have some reflux or they vomit for some reason, and they aspirate. And that aspiration is acidic fluid right out of your stomach into your lungs, causing a burning of the lung tissue and inflammation and swelling and fluid and bacteria. So aspiration pneumonia can be very deadly as well. So now, how do you prevent pneumonia? Okay, well, most of it's pretty simple stuff. You stop smoking, very important. That's a real, awakening to most people who have tried to stop smoking. They get pneumonia, and all of a sudden their incentive to stop smoking goes right through the roof. The other thing is, if you're over 65 years old, you get the Pneumovax vaccine for seniors, because seniors are the most common exposed to pneumonia, and they have the worst complications. Keep yourself good and hydrated, especially during the winter when people get dehydrated without even knowing it. They always think they get dehydrated in the summer, but you also get dehydrated in the winter. Get sleep and rest. Don't get run down. Don't get your system depressed. Good nutrition is important. Can't be just eating fast food all the time, processed food. You got to eat good nutrition, vegetables, vitamins. And if you're around anybody that's sick, wear a mask, because bacterial pneumonia is an aerosolized contagion, as is COVID, as is flu, as is RSV. So there you go. There's your update on pneumonia. Hopefully this was helpful for everybody. And, if you have any questions, like I always say, just email me at docdave@gmail.com. That's actually on call with docdave@gmail.com. And remember, I'm your friend, not your doctor. Any of these symptoms show up, you can listen to my podcast. It will educate you, but you need to follow up with your physician, or if you get real sick, go straight to the emergency room. So we'll be seeing you next time with another informative podcast on medical conditions. Thank you for your time.